Welcome back. And one of our a new partner with us is Milwaukee Center for Independence. And we're joined in studio by Mr. John Chianelli. Just call me John. And we're joined online by Miss Candace Romano. Good morning.
Good morning.
How's everyone?
Good. Thank you for having us, Keith.
Oh, thank you for coming in. And unfortunately, Terry Zawicki, the president and CEO, came down with a case of laryngitis, which is tough for radio. Television, you might be able to get away with, but radio, you got to be able to hear you. So, good morning.
Good morning.
Good morning. You two have you've been working with the Center for tell us what the Center for Independence is.
Well, I can speak to that.
Okay.
The Center for Independence has been around for more than 80 years, and we work with people of all walks, people with disabilities, disadvantages. We've been a leading provider of services for people. Like I said, more than 80 years. We're a very complex organization. We have many programs, including one that John's going to talk about, our behavioral health program. We have a brain health program. We have day programming, programs for children, including a pediatric skilled nursing center that is one of its only kind in southeastern Wisconsin. So we've got a lot going on. And a lot's been going on recently, too. We've gone through a lot of changes, as a lot of organizations have, especially during the pandemic. And we want to talk about some of those changes with you today.
Which is very interesting because when I was sitting here and we were doing the background for the conversation this morning, interesting time to choose a rebranding. Now, you probably had that on the table prior to the pandemic. But talk about all the efforts around rebranding CFI.
Sure. You're right. We did have this going on for quite some time before the pandemic. Last year, we kind of had to put a little pause on it because we were so busy just keeping things going. But we decided to bring it back, and one of the reasons we did is because we are so complex. We are one of Milwaukee's best kept secrets, even though we've been around for a long time, and families know us, but the general public doesn't really have an idea of what we do. So we wanted to simplify our brand a little bit, have more of a cohesive message, one that would resonate more with people. We wanted our logos to all have a family look to them, all be similar, so that when people see our logo, they're going to go, oh, that's CFI, or that's where brain health program is. So it's been, I'd say almost like a 2-year initiative to get our rebranding effort underway, and now almost complete. And it's just pretty exciting for us.
Now, when you say rebranding, that it gets into those steps in marketing that you introduce a product, you market the product gets to a certain level, and then you rebrand the product and then market the product. So when you say rebranding, is that in terms of a logo? Is that in terms of institutional mission? What does that mean exactly when you say rebranding?
Actually, I'm glad you asked because it's been all of that. We have a new mission. We have a new vision. We have values in place that they're fairly new, too. I'd say they're about 2 years old. So it's been a total metamorphosis. Our new mission is partnering with people of all abilities to advance their total health. We wanted to focus on total health because what we do encompasses all aspects of health, emotional, financial, physical. So we wanted to show that what we do is quite broad. And our vision is healthy and hopeful communities because especially now after the pandemic, and I say that carefully, we do a lot more work in the community. So our buildings don't matter so much anymore, as I know a lot of organizations feel the same way. We're really out there meeting people where they are. So we had the mission and the vision in place. We wanted a logo and messaging to coincide with that. And now we have a brand new logo for all of our affiliates and messaging that we think really shows better what we do and shows us more as a unified organization.
One of the things that you had talked about in terms of service offerings is behavioral health. So as the leader of that particular component of CFI, how has the rebranding impacted you?
Yeah, thank you for the question, Keith. I think one of the things that is most important to us in this new consolidated branding is to be able to reach our customer so that our customer knows by our brand, by our name, who we are and how they can access us. So that was, from a customer standpoint, another very critical component of the rebranding. We want people to be able to find us easily. So, it's about helping people gain access to our services, which is another key part of the rebranding. We are working on a part of that, as Candy mentioned. We've really pivoted the way we provide services, and we had to do that in a very short period of time. And we find ourselves providing services more and more in the community, but more importantly, virtually, telephonically. So we've really grown out of clear necessity with the pandemic our telehealth, telepsychiatry component of our services, and which in turn, our customers are telling us they like, because it's easier for them to access us when they need us at the right time, not have to sometimes take multiple buses from their home to our clinic. So we are really focused on trying to consolidate our services into our main building on 2020 West Wells.
Yeah, I was when Candace was talking about that. Probably don't need you don't need the same amount of office space. I know real estate people are not real happy about this right now. But we were probably going to be moving towards telehealth, a lot of teleconferencing anyway.
Yes.
The pandemic just probably became the catalyst to speed that up, probably, right?
Yeah, no, most definitely. I mean, it was the catalyst that allowed us to, move light years ahead of something that probably would have happened, just naturally as technologies have grown, and our agency has grown its technology strategy. The other thing that we know about, consolidating, the science is really clear about this, is that when we can provide services under one roof and not have multiple locations that people have to go to, it's easier for clients to access service, one, and then two, it allows us to treat the whole person. So rather than having to go to one of our facilities for behavioral health, another for employment, another for, benefit and food assistance, we'll have it all in one spot, making it way more accessible for our clients. And then, of course, sprinkled on top of that is our new virtual technology.
My own background in terms of working for large institutions, I know that sometimes you talk about rebranding, but those cultural shifts can be very difficult, not necessarily for your customer base, but for your service providers. Was this a difficult process to get through in terms of this rebranding, how it impacted? Because the fear a lot of times of innovation is that you're going to eliminate the need for me. How did you navigate that?
Yeah. I think the most interesting part of our past year, as we've done sort of cultural reestablishing our culture, really forward thinking about our future, is that while that was all going on, the demand for our services was growing faster than of which we could keep pace. And so really that has been the focus. And some of the things that we are doing are have become very exciting to staff because we're able to do what they want to do most, which is serve people. And so I think having the new, brand, the new culture, the new way for people to access care is also exciting to our workforce in some ways because there's a high demand for our services and it seems to keep growing.
So the rebranding didn't eliminate. What it did was it allowed you to expand capacity to deal with the need.
Right. We were fortunate during the pandemic. We received a large federal grant actually to expand services to over 600 adults, children who have mental health and addiction services. And this grant it has been vital for us to reach more people. The other thing that MCFI or CFI has done to meet the need of the community is throughout 2020, we opened a new crisis resource center, which is the third of, or the number 3. We have one on the south side, we have one kind of central on Villard, and then now a crisis center on the north side of town that operates 24/7, 365. There's counselors there right on site for anyone who's experiencing a mental health crisis. They literally can call, pop in, and get greeted by a licensed professional to help them with their crisis.
Your current location is
The
big place.
The big place. We're at 2020 West Wells in Milwaukee.
Which is a very interesting community. Just if you're just talking about your immediate community,
right,
the many needs that are there, and then you also abut Marquette University.
Yeah.
Do the students take advantage of this or no?
Well, we're hoping that as we've sort of done this rebranding, we, get our name out there in a way that people can understand that not only will we want to partner with Marquette and other surrounding schools, but with all this growth of services and funding, we need help. We need staff. We need licensed staff. We need residential care staff. So we hope people find us interesting with our new brand enough to want to come and be employed with, join our team.
The few times that I've had the opportunity to come into the facility there, one of the things is it seems to be a very intimate. How do you not lose that when you're expanding yourself where, I'm part of another organization that, we go from mom and pop to a supermarket.
Sure.
But how do you make sure that those values that you had as a mom and pop are still there?
One of our main values is that we never lose our patient, client-centered approach to what we do. That's one of the 6 values that Candy spoke of. And because I think you're right, Keith, it's very easy, as you grow and get bigger, to, suddenly turn into almost a bureaucracy in a way. Our roots is in serving the community. We really have we serve people throughout every zip code in Milwaukee County. And, that was our strategy around placing our crisis centers where they're right in neighborhoods. So that, again, people right in the neighborhood can access service. So that is a huge value of ours, to continue to focus on clients, focus on their families. That's part of our core mission.
Did you want to add anything, Candace?
Well, I think bringing our behavioral health program into our campus on Wells Street will actually have a unifying effect, because when we're at our main office on 20th Street, we interact with people from behavioral health, but we don't see them. So now we're going to be all under one roof, and we're going to see that the services they provide. And I think when we see people working together and collaborating, it gives you pride in where you work. So I think it's going to have a really positive effect on everyone who's there.
You said that that there was a need for employees. So are you currently now hiring?
Yes, we have many positions open. Visit our website, MCFI.net, and click on jobs, and you'll see, we have positions open for licensed professional counselors, social workers, positions open for residential care staff, kitchen help, employment help. So, yeah, definitely, we are looking to build our team. And this is a great time to join our organization as, we're kind of turning a little bit, redirecting the ship and, really looking into the future as we rebrand.
So, again, is there a number that people can call, or you said the website?
Yeah, the website.
What's the website?
Our website is www.mcfi.net, and then just click on the jobs section, and it'll take you right to all the postings that are open.
Candace?
Yeah. Our phone number is 414-937-2020.
So what's been the response? Has it, in terms of have people responded favorably to your rebranding?
Internally, yeah, they have. People are really excited. They're excited to use the new logo. They're waiting for more information to come out about it, our messaging. I think since we've been talking about it for almost 2 years now, people have gotten used to the idea. I mean, some might have been a little bit, you get attached to your old logo and all that. But I think because we've been talking about it so long, people are generally excited. And I think, like I mentioned before, we all feel like the pandemic's coming to an end. We want a new beginning. And I think this is sort of CFI's new beginning.
Yeah, after this, we'll never be the same, nor should we. And
Right.
I think that we have to continue to evolve. And I think you used the term earlier, metamorphosis, right? Was that the word I'd heard?
Right.
But that's all part of just our existence, that things are constantly changing. They're going to change whether we want them to change or not. There's things that are outside of our control, but the things that we can control in order to be able to better adapt to the environment, that's a benefit.
And I hope it gives people, our staff and the community that we work with, a renewed sense of purpose.
Mm-hmm. Yeah, that becomes important. Because I kid people sometimes, say, you can get old in a job, right? You can get stale in a job. So anytime that you can bring a fresh report, plus we're talking a new generation of people coming, and they bring their own challenges based on the times, and then our ability to be able to adapt in order to provide the services. So appreciate you both.
Thank you.
So again, we've been joined by Mr. John Chianelli. He is the Vice President of CFI's Behavioral Health Division. We've also had with us Ms. Candace Romano. She is basically the media person, right?
Correct.
Yeah. So we appreciate you all, and again, we listen to the ads here daily. As a matter of fact, I cut one for you. So appreciate the work that you do. Anything you guys want to leave in closing?
No.
Thank you.
Go ahead, Candy.
No, I'm good. Thank you.
All right.
Yeah, thank you so much for having us today. It's
Thank
an honor
you,
to be
and
with
nice
you.
meeting you all. You're listening
Thank
to
you.
You're listening to Community Voice. We're going to take a quick break, and we'll be right back.